I'm writing on behalf of my mother. She told me that a week ago, someone at Oak Street Health called her to make sure she was doing okay. I just wanted to say thank you to Oak Street Health for being a godsend for my mother. She has been so depressed until the lady called to check on her. Thank you.
Hi, I'm Dr. Chow from Oak Street Health.
I am Dr. Levine from Oak Street Health. Caring for adults on Medicare is my passion. By focusing exclusively on older adults, we're able to provide them the best healthcare anywhere, no matter their challenges, because that's what they deserve.
The world has changed seemingly overnight. So we're going above and beyond to make sure all of our patients have what they need to stay safe and healthy in their homes. Now more than ever, keeping up your regularly scheduled doctor visits is important to staying healthy.
That's why we're offering telehealth appointments, which are high-quality phone or video visits that don't require you to leave your home. Patients are telling us how much they love these visits.
I enjoyed the home call because my wife and I both could speak with the doctor from the comfort and most importantly, safety of our home. That was a relief considering I'm at high risk for COVID-19. My wife spoke for me as I listened by her side. She's better at talking to physicians, so I'm very pleased with this appointment because normally my wife is not able to go with me.
Plus, our 24/7 patient support line puts you in contact with a care team member day or night because your health matters to us around the clock.
It's never been more important for you to have a preventive health care plan in place and access to a care team that listens to your needs. So call and schedule a visit with us today. Our commitment to serving our communities is stronger than ever.
And it's the reason why we will be here for you, always.
All right. Hey, what's up, everybody? I hope y'all can hear me. If you can, let me know that you can hear me. I am watching the chat box right now. Hey, Sister Rob, I see you saying hey. Again, hopefully y'all can hear me. Let me know. Somebody throw something in the chat box and let me know that y'all can hear me. We have an awesome session today that we are excited about. Let's see. I'm still waiting to see. Hey, while y'all are watching me right now, make sure you're sharing this video with all of your family and your friends. Make sure you're sharing this video with as many people as you can who are 65. Yes, we hear you. Thank you, Tanya, Sister Tanya, who are 65 plus. Share this with those folk who are 65 plus. Also, if you've got some folk who are grandchildren or sons and daughters, and you are concerned about your parents or your grandparents and you want to make sure that they have access to some good information, I want you to share this with them as well, because today we're going to back up and we're going to talk a little bit about Medicare again. We talked about Medicare at the beginning of the month with our partner Oak Street Health, but we're also going to add to the information about Medicare. We're going to bring on another young lady from Harrison Consulting Enterprises, and she's going to talk about insurance today. And this is all, again, focused on our senior community. So make sure that you share this information, share this stream with someone before I go into the video. I want you to share this stream and make sure that we get as many people on as we can who can watch this great information. Now, also, what I'm going to do while I'm sitting here, let me do it. Also, today I am going to give something away today. I don't know what I'm going to give away though. I'm going to give something away today. Is that all right? Can I do a giveaway today? Can I do a giveaway? Is that okay if I do a giveaway? Can I do that today? All right. So I'm going to drop a link to Oak Street Health. They've got a special program that they want to enter some folk into, a special program. So I'm dropping the link right there. It's a bit.ly link. I have shared it. Now, if you filled this form out before, you are disqualified. So don't try to fill the form out again. All right. If you filled it out before, don't fill it out again. All right. Because you are disqualified. So you can't win this time. All right. Last time we gave away a 16-piece cookware set. This time I'm doing a giveaway. So I don't know what I'm giving away though. I don't know. I might just give you a gift card or something like that. Everybody likes gift cards, right? So we'll give away a gift. That's what we'll do. We'll give away a gift card this time. And you just tell us whoever wins this time, you just tell us what you want a gift card to, and we'll get you a gift card. All right. Sister Connor, you say, I love giveaways. All right, great. Nevertheless, we want to thank our partners, Oak Street Health, for making this information available. Again, Harrison Consulting Enterprises is our other consultant that's going to be in today talking about insurance. I'm waiting for y'all to share with as many people as y'all can. So y'all keep sharing it. Share. Let other people know that this great information is about to go forth. Also, let me say this. Let me put up another link, because if you're watching this on my page, on my personal page, because I got a lot of friends on my page. I got like 5,000, which means I can't have no more friends. Let me also say this. If you have not yet gone over and join Alive International's Facebook page, I want you to do that. I just dropped the link for that as well in the chat box. So go ahead and jump in and join the Alive page, because in the Alive page, we are offering there a lot of opportunity to share, have a good time, play games. Y'all know First Lady, Lady G, she loves playing games. She wants to do fashion shows. She wants to do she just wants to play all kind of games. She was trying to figure out how to play Uno with y'all the other day. So she wants to play games and all that. But only way to gain access to that is you got to be in the private Facebook group called Alive International. So I just put the link in there. Hey there, Sister Evelyn. I just put that link in there. You know what, Sister Evelyn, I was asking you to come on and render us a little selection. I want you to sing something to us. And you told me you weren't going to be available. Now she's in the chat box. Ain't that crazy? I wanted her to come on and sing to y'all. That girl, she has an awesome voice. And I'm telling y'all, she would make y'all be shouting on here if we let Sister Evelyn sing. She'd be shouting. I was going to have her come on and sing, just wanna praise you forever. See, I can't sing, so y'all don't want to hear me. But I was going to have Sister Evelyn do that. And ever for all you done for me, right? Blessings and glory and honor, they all belong to you. Yeah, I can't sing. I know. Y'all don't have to rip me on social media. Y'all ain't got to talk about me. I know I can't sing, but y'all know my heart's in the right place, right? All right, we ready to get going. Again, y'all share this. Y'all can keep sharing it with other people. Hey, Sister Ro, keep sharing it with other people. We're going to be talking today from our partners at Oak Street Health and our other partner, Harrison Consulting Enterprises. Today, we're talking about Medicare. We're also talking about insurance, and we want to make sure that y'all know about Medicare. I guess it's Part A, Part B, Part C, all of that stuff. I know it can be confusing. I can carry it too. That's funny. I know it can be confusing, but we're trying to clear all that up today. And I guarantee you, this is a very short session. So I guarantee you, those who are watching this, you're going to get some information that's going to be a blessing to you. And I know that you're going to want to share this with someone else. So make sure that y'all share this. And I'm about to get going. Let's see right now. Y'all enjoy it. You're going to have I think I can get past this 5-minute countdown so we can get right into it. All right, here we go. I got to get it up, y'all. All right, so it's making me choose the file and all that good stuff. So I got to go find the file and everything. Let me go find the file, y'all. Talk amongst yourselves. Talk amongst yourselves. Talk amongst yourselves. Here it is. I found it. Talk amongst yourselves. All right, y'all should be sharing the video anyway. While I'm doing this, y'all should be sharing the video. All right, here we go.
I'm writing on behalf of my mother. She told me that a week ago, someone at Oak Street Health called her to make sure she was doing okay. I just wanted to say thank you to Oak Street Health for being a godsend for my mother. She has been so depressed until the lady called to check on her. Thank you.
Hi, I'm Dr. Chow from Oak Street Health.
I am Dr. Levine from Oak Street Health. Caring for adults on Medicare is my passion. By focusing exclusively on older adults, we're able to provide them the best healthcare anywhere, no matter their challenges, because that's what they deserve.
The world has changed seemingly overnight. So we're going above and beyond to make sure all of our patients have what they need to stay safe and healthy in their homes. Now more than ever, keeping up your regularly scheduled doctor visits is important to staying healthy.
That's why we're offering telehealth appointments, which are high-quality phone or video visits that don't require you to leave your home. Patients are telling us how much they love these visits.
I enjoyed the home call because my wife and I both could speak with the doctor from the comfort and most importantly, safety of our home. That was a relief considering I'm at high risk for COVID-19. My wife spoke for me as I listened by her side. She's better at talking to physicians, so I'm very pleased with this appointment because normally my wife is not able to go with me.
Plus, our 24/7 patient support line puts you in contact with a care team member day or night because your health matters to us around the clock.
It's never been more important for you to have a preventive health care plan in place and access to a care team that listens to your needs. So call and schedule a visit with us today. Our commitment to serving our communities is stronger than ever.
And it's the reason why we will be here for you, always.
Hey everybody, this is Pastor G with Alive International. I am so excited to have each and every one of you all joining with us today. We have two great folks on today who are going to provide some very critical information that is going to be valuable to you, to your family, and to your friends. We don't have a whole lot of time, so I want to jump right on in, and I want to bring in the first guest today who's going to do a presentation that I believe is going to be a blessing to everyone. So here's what I want you to do. As I bring Brother Martin Booth in, I want y'all to share this live stream with someone who is 65 and over, someone 65 plus. Now he'll tell you a little bit more about why in a minute, but I want y'all to start sharing right now. So hit that share button, share it in your messenger, do whatever you got to do. Get on the phone, call some folk, text them, and let them know that there's going to be some empowering information that is going to be provided to you right here, right now. So I want to bring into the conversation one of my good friends, Brother Martin Booth. Brother Martin Booth, how are you doing?
I'm doing good today, Pastor. How about yourself?
I'm doing well. God bless you. We thank you all for joining with us today. And just so the folk can know a little bit about who you are before we get to our second guest, tell us a little bit about who you are, the organization you represent, and a little bit about what we're going to do today. Go ahead.
Awesome. Thank you. Well, my name is Martin Booth. I am the outreach director at a company called Oak Street Health. If you haven't heard of us before, we are a primary care physician's office. And we currently in Indianapolis have 4 locations. I'm at the Speedway office, and I've been at Oak Street for about 3 years. It's an amazing company we work for. We're doing amazing things in the community. I'm pretty sure that if you haven't seen us, you will see us. We have billboards, ads, and everything else going on. We are a primary care physician's office. So you would come to us and see your doctor. You would come to us and get your medications refilled. And today what we're going to talk to you about is how do you manage through your Medicare benefits that you work for through COVID-19. There's a couple of things that we want to let you know. There's a bunch of resources that are available to you. Some of these things you don't even know of. Like we said, you are entitled to these benefits, and what we want to do is let you know how you are able to gain those benefits. What is your experience in navigating the Medicare world? I'm sure that everyone gets the big book every year, and you probably take that book and you stick it under a table. It's a lot of information. It can be very overwhelming, especially to someone who is aging into Medicare. There's a lot of information there that you just may not get. For instance, and we'll talk about the two later, there's Medicare and then there's Medicaid. So one is federally funded and one is nationally funded. So with the Medicare and Medicaid, most people don't know that if you have been on Medicaid for 2 years or more and you have worked your quarters, you actually automatically qualify for Medicare. So again, we have Medicaid and we have Medicare. Medicare is the piece we want to talk about that you are entitled to. You work for this. There's a portion that you put away on your paycheck every time you get paid to your Medicare. You receive those benefits once you turn 65. Now, the benefit that you get with Medicare, first at 65, is Part A. I'm pretty sure everybody is familiar with Part A. If you're not, that's the Part A part of the insurance that allows for you to go to the hospital. So with Part A, again, you're entitled to that. You get those benefits right when you turn 65. If you've been on Medicaid for 2 years or more and you have worked your quarters, you are automatically qualified for Medicare. All you would have to do is just go down to your local Social Security office and apply, and you should be granted that. Next slide, please. So a little bit about Oak Street. We're different as far as your doctor's offices go. We have transportation to and from your appointments. That's every single appointment that you have with us. We will pick you up from your front door. We'll bring it to the center, and then we will also bring it back home as well too. The good benefit about this is if you have children or if you depend on someone to take you to your doctor's office or your doctor's appointments, you don't have to rely on them to do that. They would not have to call off work, take time off. They would be able to let us come and get you and take you back home. The vans are wheelchair accessible. So if you are in a wheelchair, we can bring you there. We also have a community room. Now, during COVID-19, as of now, that is shut down. But we will be reopening that as soon as we can. We also offer same day and next day appointments. A lot of times people try to get into the doctor's office because they may be sick. You may not be able to get into your doctor's office because they may be backlogged. We make time for these visits. We also make time or allot for time on the schedule to make sure that anyone that may have an emergency, we have that time on there for them. You saw in the video as well that since we're in the situation that we're in with COVID-19, we are offering telehealth video and phone visits. If you have a smartphone, you are able to connect with your doctor at Oak Street Health and have a video visit with them in the comfort of your home. If you are not comfortable with going out, you are definitely able to have that visit over the phone as well too, if you don't have a smartphone. So either or. So a little bit of options for everybody. We actually have Sandy Harris, who we will hope to talk to soon, with any questions that you may have about your insurance. We take all the major carriers. There's Aetna, Humana, UHC, and then there's Anthem. So we take the 4 major carriers here in Indianapolis. If you need to navigate through any of those, you can feel free to reach out to us and we will get you in touch with the right person. Hopefully Sandy will be that person or someone like her. We also have 24/7 patient support line. So if there's anything that you may need, you can call us up. It can be 3 a.m. You will be routed to a live person and you'll be able to speak about what's going on. Usually that would be a nurse who would be able to triage you. If that issue is serious enough, then you would be routed to the doctor. But we are accessible 24 hours a day, 7 days a week, 365 days a year. Mail order pharmacy support and access to basic amenities when needed. So if you, for some reason, you can't get over to your pharmacy and you need to get your prescriptions delivered to you, that's no problem. Nowadays, they have everything that you can do through Walgreens, CVS, your local pharmacy. However you get your prescriptions delivered to you, you are able to do that through your mail order. So that's another benefit that we add. We also are able to keep our patients healthy and out of the hospital. So a great number, over 50% of our patients are healthy and stay out of the hospital just because they are a patient at Oak Street Health. So again, we encourage you to come and try us out. So we said earlier that Oak Street Health is not an insurance company. We're here to help you understand Medicare and your options. From here, we can refer you to an insurance agent who we know and trust. Now, as I'm not an insurance agent, I cannot speak to you on the benefits of Medicare, but I can put you in contact with someone who will be able to tell you detailed information about the plan that you're on or on a plan that you may be interested in. Right now, I know that the special elections period is extended through June 30th, and then we have open enrollment that starts in October. Open enrollment at the end of the year, you want to make sure that you are active in that so that you can plan for your benefits for the following year. So again, we're not an insurance company, but we do have partners that we work with who are able to answer all of those questions for you. Let's go to the next slide. Who gets Medicare? So Pastor G, you asked this earlier. Are you eligible? People 65 and older, typically we think 65 for senior citizens. Yes, that is the technical age for senior citizens, but that is not the age that you must be in order to receive your Medicare benefits. So there are a number of people who may have a disability and they're under 65. We have those patients. If you are under 65 and you were born with with a disability and you aren't able to work, if you were deemed by Medicare, Medicaid, whoever does those things, and they deem you as someone who is not able to work, you are automatically qualified for Medicare. You get those Medicare benefits. We do have 20-year-old patients. So again, 65 is not the typical age or the number for all to be qualified for Medicare. You can be younger. So Medicare coverage related to COVID-19. Medicare actually covers testing for COVID-19, and I can't speak to exactly what the verbiage is on that, but there are benefits that are paid for the testing. The deductible and the coinsurance is also waived. COVID-19 treatment covered under Medicare Part A and B. Now you see, now we have a Part B here. I told you about the Part A. The Part A, again, is the hospital part that you automatically get when you get your Medicare at age 65. The Part B is actually the part that pays for the doctor. So if you go to your doctor and you want to be seen, you have to have that Part B. You also have to have that Part B, of course, if you're going to come to Oak Street Health. We run that through the system for you, the state system. We make sure that you're eligible. We make sure that you have that coverage. And again, we want to make sure that you are covered when you come to us for a visit. You shouldn't have to pay any out-of-pocket expenses unless you have a copay already set up with your insurance plan. If you have that, it's going to be the same thing when you come to us. We have a welcome visit. Is the very first visit that you guys would encounter if you chose to sign up for our services. So again, you must have that Part B in order to see a physician at Oak Street Health. Part A covers the hospital only. So you want to make sure that you get that. Of course, that's what you get automatically when you turn 65. The Part B is the part that you need to have in order to see your physician. If you're on a Medicare Advantage plan, which we'll get into later, you would be able to roll that all into the same thing, and you would just use that one card. So again, Part A, Part B. All right, so what is the difference between Medicare and Medicaid? Again, Medicare is federally funded. It's a federally funded health program for people over 65 and for people with disabilities. The CARE is, of course, for adults. The Medicaid is for the state-funded health program for any person with low income. So aid, you think of low income. The CARE is for older adults. So they get mixed up and confused at times, but the Medicare and Medicaid, you can have both of these. That is called a dual eligible person. So if you have Medicare and Medicaid, you are dual eligible. Your Medicare is paid through your Medicare premium, is paid for your Part B, is paid through your Medicaid benefits if you have both of those. So they take that out of your compensation that you get from your Medicaid to pay for your Part B premium on your Medicare. So you take that off top. You don't see it. It's already billed. They get their portion of that, and you're all taken care of. This is a great plan to have. This is a great position to be in. There's the Medicare. You can have single Medicare. We call that traditional Medicare. There's the Med Sup, which is the Medicare supplement plan. That's typically the most expensive. It covers the other 20%. Then there's the Medicare Advantage plan. That's everything wrapped up into one. That's your all-in-one card, low to no premiums. We have added benefits, dental, vision, over-the-counter benefits, and more. You see the other plans don't offer those as well. And then you have the Medicare, Medicaid plan that's all grouped together. So you have to qualify for that one. That's the all-in-one card with no premiums and the added benefits. If you see, the last two are the only ones that you are able to have the dental and vision and over-the-counter benefits. So those are the different types of plans that are out there. So you see with Medicare, there's a bunch of things that, or a bunch of options that you have that they're going to pose questions. So again, we're here to help you answer those questions as well. There's a lot of people who are on a fixed budget. You know, they have a certain income guideline. They can't go over a certain amount of money per month. So knowing this and how much you're going to spend is very good information for you to know. Again, so you can connect with us. You can connect with Sandy. Feel free to reach out. If you want to try us out for an appointment, we have the telehealth. We'd be more than happy to see you, talk to you, and help you navigate through these things. Again, I want to let you guys know that the special enrollment period has is going on. It has been extended to June 30th. So you may qualify for a special enrollment period if you missed your chance to enroll in the health or drug plan due to COVID-19. So we're happy to help you out and talk to a licensed insurance agent about that. Again, most people don't know that it has been extended. I personally just found out a couple of weeks ago, but it has been extended through June 30th, 2020. So make sure that you get those benefits to you. Also, we talked about, next slide for me, the open enrollment. So that's at the end of the year. So every end of the year, there's 3 months where you have an opportunity to enroll in the plan that you want for your benefits for the following year. So that's going to be October 15th through December 7th. It's coming fast. It's going to be very busy. Make sure that you have all the information that you need in order to choose your plan for 2021. Very good information. Again, the information changes every year. We want to let you know that we're here for you as well, now more than ever. Since the pandemic is going on, again, we have televisits. If you want to see a doctor through video, through your phone, if you want to talk to them over the phone and have your visit, you can do that in the comfort of your own home. Give us a call. Give me a call. Let us know what we can do for you. If you don't want to get out the house, again, give us a call and we'll let you know what we can do. We'll get you scheduled and get you an appointment. Some safety tips as well. During the pandemic, we want you to make sure that you're staying at home as much as you possibly can. I know the stay-at-home order has been lifted, but we want you to still practice social distancing, wash your hands at all times, have a preventative health care plan. Also, call a doctor if you're feeling sick or need some help. Don't visit the emergency room. We don't want to overload the emergency room. There's a lot of issues going on there already, unless you're experiencing a medical emergency. So those are just 5 tips that we wanted to offer you guys to make sure that you're staying safe during the pandemic. Again, I want to thank you guys for attending today. If you know anybody that can benefit from this, as Pastor G said, it could be your aunt, your uncle, your cousin, your friend, your sister, your neighbor. Just give us a call.
Sandy is our local senior health advocate. Now, if you know what an advocate is, that's just a person that presents your cause and represents you.
Okay, I am going to pause right there. I'm going to pause right there because I want to remind all of those who are watching, before we get into the insurance portion of today's session, I want to remind you that I am posting in both Alive International, and I'm posting it on my page too, the link that you can go to win a $25 gift card from Pastor G. All right. So I'm putting that in there. And let's see, gift card from Pastor G. So I'm putting that in there now. So make sure that y'all go in and y'all sign up for that. I put it into the chat box. So go in and sign up. And also, if you're watching this and you're not watching in the Alive International private Facebook group, I'm going to also put a link in. Let me go find it. I'm also going to put a link in for the private Facebook group because I want you all to take advantage of all the great stuff we got going on. Okay. So let me put that in there as well. And that's Alive Facebook group. I want y'all to join that because we're going to be doing a lot of great things. And eventually the giveaways that I'm doing will only be given away inside the Alive group. So that means you won't have access to it if you're not a part of the group. So please go in and do that. Please go in and fill out that form to enter to win the $25 gift card from well, it's coming from me, but you're going to be signing up for some special programs at Oak Street Health. So just want to remind y'all of that. All right. And I'm going to go back to the video. And again, y'all can get some folk in so they can watch this. This particular portion of the video is about insurance. Okay, it's about insurance for our seniors. You don't have to be a senior. It could be your mother, it could be your father, it could be your grandparents, it could be a friend. So this information is critical. So let's go to that right now.
That can benefit from this, as Pastor G said, it could be your aunt, your uncle, your cousin, your friend, your sister, your neighbor. Just give us a call.
Sandy is our local senior health advocate. Now, if you know what an advocate is, that's just a person that presents your cause and represents you. So we want you to meet Sandy, and she's going to be talking to you in a little more depth than what I have. But we want you to understand we're in your local community. The Senior Health Resource Center, as I said, is in churches. It's in we have it in senior facilities. We have it in community civic centers. We're here to serve you because you served for so many years yourself. Thank you. God bless you. And make sure and listen to Sandy well.
Hello, my name is Sandy Harris of Harris Consulting Enterprises, and I am your Senior Health Resource Advocate, specializing for over 15 years in the Medicare health market for seniors and disabled. You know, there's a lot of misinformation and confusion in the marketplace, as my partner Larry just mentioned. However, I'm here today to help you navigate through this maze. And I say it's a maze because it's just difficult to understand all of the nuances of the Medicare industry. But we're going to be introducing you to a new program called Senior Health Resource Center. Senior Health Resource Center, helping you get more from your Medicare. The Senior Health Resource Center is a free educational resource to seniors. You did not misunderstand me. Free, a free educational resource to seniors. We help answer questions and educate seniors on the many new benefits now available to adults on Medicare, helping them access thousands in available government program dollars. We are supported by Medicare insurance companies at no cost to the public. Yes, no cost to the public. We are a free educational resource to seniors, as well as population at large. We help answer questions and introduce the public to many new benefits now available to adults and disabled on Medicare as well as Medicaid programs, helping them access thousands in available government program dollars. We are supported by the Medicare insurance companies and at no cost to the public. Senior Health Resource Center can simplify Medicare. Yes, I said the magic word in Medicare, simplify Medicare. Which Medicare plan makes sense for me? You know, not all Medicare plans are created equal. So what we do as insurance brokers in this arena is to help you locate and find the Medicare plan that meets and exceeds your needs. How can I save on my prescription drugs? Well, there are several ways in which you can really save on your prescription drugs. We educate you to that fact. One of the, I would say, most popular ways is by joining what we call a prescription drug plan. You can save within your plan through tiers, tier 1, tier 2, which are the least expensive drugs. And those are usually generic or brand name generics. You know, do veterans need Medicare? Of course, veterans need Medicare. For those veterans that are utilizing their Veteran Administration Hospital and Medical, we have a plan especially created for veterans without the drug portion to the plan. 90% of the veterans that are on these plans utilize the veterans drug pharmacies because, for the most part, they don't have to pay too much, if anything. But the other part of the plan, the medical portion, is addressing their needs as well beyond the veterans plan. So please feel free to call me. I will give you my contact information at the end of the presentation. Medicare supplement versus Medicare Advantage. This causes probably many of the questions throughout on a daily basis. People simply don't understand the difference between the two. I will give you a graphic indication of the Medicare Advantage versus the Medicare supplement a little bit later in the slide presentation. Do I have to pay Part B premiums? Of course you have to pay Part B premiums. Hey folks, there's no free lunches out there anymore. Part B premium has to be paid by everyone on these plans, with the exception if you're Medicaid and Medicare. Comparing your Medicare options, option A, option B, option C. Option A is original Medicare. You know, your red, white, and blue card with Part A and Part B. As you can see here, the common denominator in all of these different options is Part B premium. Guess what? Everybody, as I stated earlier, will have to pay the Part B premium, or else you don't have coverage in that area. Part A, you earn. Part B, you must pay for. So in option A, you can see that your total exposure, I know that's a large figure, isn't it? Over $21,000, almost $22,000. Now, you may ask the question, why is it so expensive? It's expensive because you have not covered 20% of the plan. Medicare, remember, Medicare pays 80% of our medical health coverage. But guess what? 20% is left up to you to cover. And this is how you can do it. In the next example, you have option B, Medicare supplement. As you can see, it's covered 20%. So now we have Medicare original and option B, Medicare supplement, and that covers 20%. But that's what your total exposure is. Certainly not over $21,000. See how much your price goes down, the cost of these plans? Total exposure with this example is over $3,000. It's almost $3,700. So, hey, that's decent, right? But most of us can't live with that cost. So let's look at the last option. As you can see, the Medicare Advantage is number one, is actually covering your 20% exposure. So that's good. But your total exposure is just a little bit over $3,000. So why is this so inexpensive as far as your coverage exposure? Is because you have everything in this one plan that you need to have a comprehensive medical plan, especially the Medicare medical plan. So that is so important. Option B, you're covered, but guess what? You have to add on Part D, your drug plan. Over here in the last option, the Medicare Advantage plan, everything is in the plan that you will need, which actually drives the cost down. Plus you have the 20% coverage that you need as well. You have the drug coverage, you have the medical coverage, you have the hospital coverage, and your total exposure is a little bit over $3,000. We help seniors with the following services: answering questions, lowering the drug cost and the health premiums, as I just explained in that model, access thousands in Medicare dental and hearing aids. Yes, you heard me right. Even hearing aids are part of the benefit package, as well as dental and vision. Access hundreds of over-the-counter dollars. This is an awesome coverage. We call that extra essentials, over-the-counter dollars. And if you want to learn more about over-the-counter dollars, please give me a call. I'll be more than happy to go into detail with you on this. This is a benefit that many that has these Medicare Advantage plans, they just love it. They really do. And then navigate your personal health plan. Many beneficiaries that hold the Medicare plans, they don't even know, but maybe 2% of what they have. That other 98%, that's what we educate you on, the Senior Health Resource Partners, to help you navigate your personal health plan, help you to understand I've got certain benefits. And with those certain benefits is a huge advantage in being able to service you on your plan. And that is a win-win situation. The Senior Health Resource Center. You have my contact information as well. To reach me, you can just call 317-506-6560. And my office information is as follows: 14704 at Trade Center Street, Suite 500 in Fishers, Indiana, 46038. That's 46038. We are here to answer your questions, to help you with your concerns, and to give you a better experience in your Medicare health program. I want to take this opportunity to thank you for listening. It's been a pleasure to service this market, as I said earlier, for over 15 years, and we're looking forward to 2020.
Hey everybody, this is Pastor G, and I am so excited about our partners who are sharing such great and awesome information with each and every one of you. And we realize, and we are just thankful that we can provide this information, because right now during COVID-19, this is important information that could benefit you, your family, and your friends. And so right now, I just want to let y'all know and remind those who did not get to see the latest webinar that we are introducing Alive International, which is designed just for our family that are 65 and older. It is called Alive International, and it is a private Facebook group that is designed just for our family that is 65 plus. And so we want you to jump on over, and we want you to join that private Facebook group, because not only are you going to receive great information like what you just saw, but you're also going to receive additional information that will allow you to do things like have fun, connect with others, share information, and really support one another in the midst of what it is that we are going through. If you don't know how to find that page, it is okay. Just find someone, some young person somewhere who can get you close to that page, or you can reach out to us and we'll get you to that private page so that you too can take advantage of this great information. Again, this is Pastor G. We're opening up a brand spanking new private group called Alive International, and we want to share this with you. So make sure you connect with us. Make sure you go to facebook.com/Alive International, or just type in @Alive International, and you too can join this private Facebook group, and we can do Bible studies, we can do sermons together, we can share great information together, we can have fun together, we can play games together, all that kind of great stuff. And so we're looking forward to seeing you over there. So make sure you join as soon as you can so that you don't miss any of this great information. Again, I'm Pastor G with Alive International. God bless y'all. We'll see you in the private group. All right, peace. All right. Okay. All right. So that concludes this particular session today. I want to make sure, let me see here. I'm going to turn that down a little bit. I just want to make sure that y'all remember to share this with as many people as you can. I can almost guarantee you that there's somebody that you know that needs information on Medicare, and that there's somebody that you know that needs information about their insurance, okay? Especially right now as we're dealing with the COVID-19 stuff, okay? Right now is a critical time for people to have insurance and to know how to get their checkups, and if you can't leave your house, how to do the telehealth thing. And so Oak Street Health can help you with that. So hopefully what you did was you wrote down the information. If not, you can go back in the video and you can find that information out. If you just back up in the video, just scroll back and you can get there. Remember to go to Alive International and join that page. Remember to do that. Also, if you scroll up, I put in there a link that if you sign up with Oak Street Health to learn more about their services, then you will also be registered and entered. You'll also be registered and entered to win a $25 gift card from Pastor G. So I don't know who's gonna win it, but if you go ahead and register, we'll be, that'll be a blessing that we can offer to someone. I had something else. Oh yeah, Bible study. Man, thank y'all for joining in on Bible study last week. I think that was last week. We had a good time on Bible study last week, and some of y'all said that y'all want to continue to do Bible study. So we got to figure that out and figure out, if we're gonna do it once a month or more. But right now, we're gonna see you on the third week of August for Bible study. So make sure, again, that you are on for Bible study. Now, next Tuesday, we're going to see if we're going to be on next Tuesday. All of this depends on if we have some sponsors to support the work that we're doing. So if we have some sponsors or some supporters, we'll be on again next week with some more information. I really want to get on some information about depression and mental health. I really want to do that. So we're trying to find somebody that will support that, as well as, y'all remember Mindful Movement. We want to kind of keep that going. But again, it all depends, because we got to, support those people who are providing all this great information. So y'all do what you can to support what we're doing, and also do what you can to get people to sign up for the Alive page so that we can keep empowering our seniors with great information. All right. No. Okay. So if you've already signed up on if you've already filled out that form and registered with Oak Street Health to get more information, then you are not qualified to win the $25 gift card. You can't win twice. All right. So I'm just letting y'all know, if you've already filled it out, you can't win twice. So you can't enter twice. So don't try to sign up again if you've already signed up once. Okay. All right. So we got some new folk that need to sign up, and they need to get a chance to win. I think that's it for me. This is Pastor G. Thank y'all for joining. I'm gonna go ahead and pull away, and I will see y'all again on next Tuesday at 12 o'clock noon on the Alive International page. God bless y'all. We'll see you a little later. Peace.